I thought I'd talk to you about something positive, and that is why nurses like their jobs. Many of us do. So many of us that made it a lifetime career, and I'm one of those people. So when I say nurses, I'm talking about nurse practitioners, physician's assistants. These are the master's level prepared nurses. I'm talking about RNs, talking about specialty RNs. I'm talking about long-term care RNs. Nurses also includes licensed vocational nurses, licensed practical nurses, all of the above. So, and nurse aides and medical assistants. So when I say nurses, I want to include all of those. And if I'm telling you some specific information about one of those positions, I'll say, oh, I'm talking about NPs, nurse practitioners, or I'm talking about RNs, or I'm talking about LVNs. So this topic is a kind of a general, and I think that the information, most of this information has come from the acute setting, the hospital setting, where the interviews were being done. And I do think the majority of the nurses being interviewed were RNs, but others were included as well. So I'm going to give you 8 reasons why nurses like what they do. And one of the main reasons is that nurses like to help. They like to help save lives, and they like to help when people are at their lowest, and we don't see people at their best often when they're not feeling well, and they can help. And so that's really gratifying, you know. I have it just came to my mind when I was researching this topic, is that when I was in the throes of running my own nursing agency and sending a lot of nurses to a lot of hospitals and other healthcare facilities, someone that worked for me, actually worked for me, but was a private contract, was my bookkeeper, one of my bookkeepers over the years, and he just wasn't well. And I noticed it when he first came to work, and I asked him how he was doing, and he said he was okay. And about a half an hour later, I asked him again, and he said, well, actually, he didn't feel that well. He felt anxious. Anyway, he was describing things to me, and I said, I think you need to have your blood pressure checked. I think you better go to the doctor or the urgent care, and I don't think that's it. You're done for the day. You got to go take care of yourself. And he did. He called his wife. They went, I don't know where they went. I think they went to an urgent care. And his blood pressure was sky high. It was dangerously high, and he got it taken care of. And the next time I saw him, he said, you saved my life. And maybe I did. Maybe if he had ignored his symptoms, his anxiety, I can't remember, it's a long time ago. But I think after being a clinical evaluator, which we nurses are at all our levels, you know, from the nurse aide to the LVN, you see that big spectrum of wellness and unwellness and disease and symptoms. And whatever he was presenting with, you know, it wasn't one thing, it was 1, 2, 3 things. And he was very concerned about how he felt. I'm sure there was a headache. There was a lot of anxiety, some agitation. This is a very quiet man. Anyway, yeah, that's a good feeling. I mean, I knew he was not well, and I wanted to help him. You know, we're friendly and work together and so forth. But he came back and he said, you saved my life. And that was pretty nice. Okay, so nurses like to help each other. So A, they like saving lives. B, I said I'd give you 8, so I've got to count. So 1 is we like saving lives. 2, we like helping people when they're low to feel better. We have actual tools and tricks to help people feel well. Some nurses just, in general, the business of being in the business of helping a patient is enough for them, however they can help. And so that's my number 3. Number 4 is developing relationships with patients and their families. And that does happen. That happens all the time. I mean, I think a lot of people, you know, in the people job and the service jobs, airline attendants, and what are their titles? We used to call them stewards and stewardesses. I think it's attendants, airline attendants. That actually, I was just reading, a friend of mine does that for a living, has done that for many, many years. And I was just reading how all-encompassing that job is. And I actually was able to step up as a nurse twice during travel flights and interact with the airline attendants. And yeah, they have an interesting and powerful job, and they do it well, most of them. Anyway, so building relationships, that happens. I don't know why I went there. I was thinking that sometimes you meet someone on a flight and you make a connection. You may not take it anywhere after that flight, but you actually make it, you build a sort of a mini temporary relationship. You relate to one another and enjoy one another and learn from one another. So building relationships is my number 4. And number 5, we'll dwell on a little bit. We'll get into some of the specifics of the marketplace. But the market and the amount of jobs available to nurses and healthcare workers is a good market. There's a lot to choose from. So that's my number 5, and that's my highlighted one. I'm going to come back to that. And number 6 is the ability to meet different types of people. So you meet virtually a stranger. It's the first time you meet, so you're a stranger. And they have different cultures and different ways of life and different stories and nationalities. And that is appealing to kind of come out of your small bubble of your world and your culture and the way you've done things most of your life, and you and your family, and to be thrust into that is something that really appeals to a lot of nurses. That's my number 6. Number 7 relates to number 5. The marketplace is the salary, particularly for RNs. It can be a really lucrative salary, can be better than the average American salary. So that's helpful. Right? And it's not too bad for some of the other disciplines, the LVNs and the EMTs and so forth. In different states like the Northeast, Boston, Massachusetts, Connecticut, some of those states have better rates than, say, some of the southern states, Alabama, Mississippi. So it's interesting. That will vary, but then cost of living varies and so forth. And then finally, number 8 is the mentoring of other nurses. So a lot of times, kind of like me, I do a lot of coaching and counseling. And so I've been, well, when I was employed as a nurse, I would mentor and precept. So if I were working in the ICU and somebody was new, they would have whatever they would have, 3 weeks, 4 weeks of internship, like an internship. They're paid and so forth, but they're following. And sometimes you'll break up your patient load so that they have one patient, you have one patient, and you keep checking in. And you know, it's constant training, reviewing, and so forth that's going on. And so that ability to mentor is wonderful. That happened to me very early in my career, just because of the nature of my profession and my license. I was in a thrust into a teaching position for others that that were maybe not licensed. So yeah, so that's it. So that's a variety of things, and that's very, very positive, and it keeps you going. You know, when you enjoy your job, it's a beautiful thing. It's a beautiful thing, as I will quote Martha Stewart. It's a beautiful thing. Okay, so I said I'd go back to 5, which is the marketplace, and talk about that and the salary related to that. So the marketplace is good because people live longer, and there's a big focus now on preventative medicine and wellness teaching, and so we call it healthcare, but really it is more of an injury and illness system to maintain health, to get to your healthy state. But the profession is actually looking at why not, and this is an old premise that Mr. Kaiser, who started his own really, I'm losing my terms. I'm thinking as I'm speaking, and it's not all coming out right. I apologize. I should have been more, this is a thought that I was just thinking. But Mr. Kaiser, who created the huge Kaiser Permanente healthcare system throughout the United States, started with a gentleman back in the early 1900s, I believe, and I don't know, I'm not going to throw dates out. A long time ago, Mr. Kaiser was a businessman and had a lot of employees and thought how important it would be. So he really, to me, before managed care was a term, was practicing managed care for his employees. So he created clinics and preventative medicine and hospitals and so forth, and it grew from there. But it originally started for an employer that wanted to take care of his employees, and that is a beautiful thing, and that was really the premise of what started Kaiser by Mr. Kaiser. Okay, so I always digress. I didn't mean to talk about Mr. Kaiser, but so the marketplace is good and strong because we're living longer. There's a bigger focus on preventative medicine. So, for example, you go in every year, everything's good, your blood pressure's good, your numbers and labs are good, and you maybe fib to the doctor that you're exercising 3 times a week when you're exercising 3 times a month. But you should be doing all those good things to take care of yourself. A good diet, plenty of sleep, plenty of fluids, exercise, mental health things, you know, doing things that you enjoy, like dancing or singing or hanging out with family. People get enjoyment from so many things: art projects, gardening, movie clubs, book clubs, whatever it is that is good for you are things that balance your life, that keep you well, emotionally, physically, mentally, all of the above. So, so medicine is looking at that, and you'll see when you go in for your annuals or to your clinics that the focus is on preventative medicine, and a good interview will catch maybe where you're slipping up or where you're doing a good job. You know, you say you exercise 3 times a week. How long do you exercise? Oh, an hour. That's great. What kind of exercise do you do? Is it aerobic and so forth? So you learn things about your patients that will keep them well. So, so it's increasing for that reason, because we're aging, because we've added the focus of not just injury and illness, but preventative medicine. In other words, you avoid medicine and surgery by staying well. And then wellness in general has become its own focus. So that takes time and effort, right? And my friend started her own wellness business. It includes energy work and acupuncture and energy work and relaxing and acupuncture and all kind of massaging and a variety of treatments and coaching and counseling, all of these things in the wellness realm. So, and the fact that we're living longer, and the fact that new diseases, I don't want to bring up a negative thing, but we are facing still a pandemic in our world. The COVID-19 is almost reaching its peak, its apex, they're calling it. The death tolls are high, but I can't wait. I honestly can't wait to see. We're so fortunate in this country that we can trend and track to see the people that survived, the people that contracted the COVID and survived. Just like the flu every year, there are a lot of deaths related to the flu, but most of us survive. And so it'll be interesting to see the balance, even though it's scary to see that our numbers are going up into the thousands and so forth from the COVID virus, the mortality, that we're going to find many, many people when we're able to test everyone who had it and survived and built some antibodies. So that's going to be a great thing. So the marketplace is strong. And I believe in New York, I just heard that the governor of New York is going to make I don't know the term for it, but he's going to make it pass that the medical students which graduate in the spring will be able to start their practice sooner. They could start now because the teams of doctors and nurses and techs and therapists and respiratory therapists and emergency medical techs and ER doctors, all of those people are going to need to rest. And God willing, not too many of them get sick, but some of them will get sick. And so he is granting that medical students get an early release and start practicing. So that's pretty amazing. But that just tells you that the need is there. The need is there and growing. So the aging population, the event of new diseases, and the different forms of care, the preventative and the wellness and so forth, is all reasons for the market to be good and strong and growing, constantly growing. And just population. Our population is always growing. So all of the above are reasons that the marketplace is good. And then number 7 was the attractive salary. And that will vary greatly. I've talked about salaries before, and it does vary greatly. And it varies in the different realms of healthcare. So the hospitals usually are the most competitive, but not always. Not always. The need for long-term healthcare, then we talked about this a lot too. The long-term care, which is under the long-term care, you would have LTACs, long-term LTAC. Long-term acute care hospitals, LTACs. So those are the long-term acute care hospitals with the average stay being 30 days, oftentimes more. And those are they're ill, they're acutely ill, but they don't qualify under most insurances and so forth to stay in the hospital setting, which is usually a short-term setting. So those areas are growing. The LTACs, other long-term cares, the skilled nursing facilities, the skilled nursing hospitals, the rehab hospitals, the senior living, the assisted living, the memory care, all of these areas are growing because our population is growing. So the salaries are going to vary. There's many, many urgent cares, doctor's offices, clinics, surgery centers, places that didn't have bariatric centers. So there's places that didn't really exist 50 years ago that has caused that increase in need for healthcare workers and nurses, and for salaries to be bumped up because you have to compete and you have to bring in, appropriate people and pay them appropriately for these different areas. So we'll start with CNAs and orderlies. Orderlies, I don't know if that term, transporters, orderlies, a lot of those areas have grown as well with the population of hospitals going up. So they're in the $30,000 to $32,000 range. That will vary greatly depending on if the CNA and the orderly is working in a hospital, big medical center, or a long-term care facility, like a skilled nursing facility. So those salaries will range. So you can probably go $5,000 or $6,000 either way from that $30,000 range. But that's about where that is. And my statistics are mostly from 2019. I haven't found anything much for 2020 yet. So CNAs, phlebotomist, hugely necessary in all our clinics and labs. And I didn't look up lab techs. Lab techs make a considerable amount as well. And there's all kinds of varieties there of depending on if it's a specialty lab or your basic lab in a hospital or in a clinic. But phlebotomist, the people that draw the blood, and they're very good at it. I always compliment them when they do well with me or a family member. But they make about $35,000. And again, that can vary, a little higher, a little lower. But $35,000 for a phlebotomist. What else did I note here? Surgical techs. Doctors are going to be hugely different everywhere you go, and that will be based on the need. Radiologists, interventional radiologists, surgeons, various specialty surgeons, general surgeons, there's going to be just such a huge variable. But I will say, from the what did I do? Did I move my camera? I hope you still see me okay. Let's see if I can fix that a little bit. I think I moved it. Sorry. Anyway, so those doctors, I'm just going to throw this out like 225 grand, about. I haven't researched it too much. And there's such a spectrum of, if you need a thoracic surgeon, you need a thoracic surgeon. If you need a shoulder specialist for your wrecked shoulder, and you work in construction and beams fell on you, and good grief. So you need those specialists, and they will, they're worth their weight in gold, and you will probably, the bills will be different than your general practitioner, your family practice, and so forth. But I want to say 225,000 is a good, modest range for the average doctor. And God bless them for what they do and their knowledge. And my last video, I did encourage you to watch a video. It's a little edgy, was a surgeon, and he took us through a lot of what the COVID virus is doing. It was a little edgy, it was a little technical. I really got a kick out of him. He spoke plainly and funny, and he mentioned pimps. And I liked it. I hope you liked it. I hope I didn't offend anybody, but I think that doctor was fantastic. And he's also an author and a bariatric surgeon. He's done a lot of practice in that. So he's pretty knowledgeable. So doctors, yeah, I'm not going to go too far into the doctors. Let's talk about RNs. I want to say, and I'm talking in the United States, so this will vary if you're in Hawaii or California or Massachusetts or Alabama, Texas, but I want to say 80,000 is around what an RN can expect to make working full-time. And there will be a lot of variables there as well. Do you do overtime? Do you work 12-hour shifts? Are you a traveler? Are you making, bonus money for your travel? There's a lot of variety there. Are you working in long-term care? Are you working in acute care? Are you working in the middle, in the LTAC? So that will vary. Home care, all of it. There are a lot of variables. But these are good living salaries. The surgical tech, for example, did I mention that? 48, 49,000. And there's surgery centers popping up everywhere. I had surgery, long enough ago that I don't remember exactly when I had it. I had shoulder surgery, and it was same day care. It wasn't even, I don't even think I was there full 5 hours. And I had breast surgery, and I don't even think I was there. How long was I there? I showed up at like 5:30 in the morning. I don't know. I want to say 6, 7 hours I was there maybe. So yeah, so there's a lot of outpatient surgery and a huge need for surgical techs. So there you go. I don't know, I feel like I keep moving my camera. I'm not centered. But oh, look, my little nurse doll is there. So my dear healthcare workers, my nurses and CNAs and so forth, enjoy your job. There's many, many reasons. I mentioned 8. Maybe you have other reasons, but relationship building and good marketplace and job availability and salaries and choices and mentoring and working with your team members and helping, saving lives, all good stuff. Makes me glad I chose it. Makes me glad I found it early. I thought I'd be a teacher. When I was very, very young, I thought I'd be a nun. That could be because I was surrounded by nuns. But I discovered nursing, and I'm so glad I did. It's been a wonderful, wonderful, wonderful career, and taught me so many things. And I have many, many skills that I'm conscious of, and probably several that are just almost like second nature. Like once you learn to ride a bike or drive a car, you know, it's a very natural process. So it's very natural for me to evaluate, to clinically assess, to deduce, to do a lot of critical thinking, it's part of who I am. It's part of who I am, and I'm very, very, very grateful for it. And we'll probably continue to do it till they tell me to stop. You know, I'm semi-crippled and semi-blind and so forth. But yeah, I like my job. I always have. It's offered a lot of variety. I've talked about some of the things I've done, ICU and dialysis and home health and many, many things, clinical management, clinical counseling. Yeah, it's been great. It's been absolutely great. All right, so I wish you all well. Don't forget to be scrupulous hand washers on the job and off, and wear your mask to protect others. It's really funny. I've been very, very close to home, and so my big outings are mostly walking the dogs, and I see people walking around with masks, and that's a little bit silly. I do wear a mask, and I have it on me. So I have a bandana and I have it tied down, but I'm not covering my face because I'm not, you know, 6 or 8 or 12 or even 20 feet. I'm me and my dogs and the trees and the streets. Yeah, so you wear a mask to protect others, and they should be doing the same for you. So if you go shopping, you go any place where you're interacting with people, you don't know who they are, we don't know who the carriers are, so practice wearing your mask, washing your hands scrupulously, and if you're wearing gloves, and they're, you know, old-fashioned gloves to keep out the cold, and you went to the grocery store and you were wearing your gloves, come home and wash them, okay? Or use disposable gloves if you can get your hands on it, or just wash your hands. And you should be fine. Most of us are fine. And I wish you continued wellness, and I will talk to you again. Oh, I did want to add, I'm speaking to you from Gold Medical Jobs. We've been around for quite a while. We're known, you can find us at www.goldmedicaljobs.com. rita.goldmedicaljobs.com. You can email me at rita@goldmedicaljobs.com. But look for us. Our name is going to change to Medical Jobs Channel. Medical Jobs Channel. So look for that change. It's coming soon. Everybody's working from home, so things are getting done a little bit differently. But our founder and CEO came up with a Medical Jobs Channel. And so look for that change. You'll be directed right from Gold Medical Jobs to Medical Jobs Channel. Doesn't roll off my tongue that easily. Medical Jobs Channel, soon to arrive. And I will speak to you from there when that changeover occurs. It'll be the same me. It'll be the same process. You will find us on YouTube and Facebook and Instagram, Twitter. We're on all these different venues, but we will soon be Medical Jobs Channel. Okay, great talking to you. Stay healthy, be well, enjoy your job.